Hello everyone, thank you for joining me. I have been asked to do an in-service about professional behaviors related to nursing. Um, Here we go. Okay, my objectives are, I have two. I have to identify professional behaviors and hopefully put them in practice. Sorry. Okay, the number two will be to recognize where one needs to improve or work on any of them. So they're simple. We should all be familiar with them, and here we go. The first one I would point out would be one would like to be civil. Okay, we want to treat people with respect. We want to treat people the way we would like to be treated. We, as coworkers, don't have to like each other in order to respect each other. I think one can have difference of opinions and still make the work environment a friendly one. Okay. The second one will be to be honest, be forthright, do not participate in gossip or rumors. That's one of the traits that we should all be practicing. When one has a problem with anyone, we should go to that person and explain what it is that we have a problem with and try to understand and find a common ground where we can both improve and clarify any misunderstandings. The third one will be to be consistent. Behavior should coincide with values and beliefs. We have to project a positive attitude every time we're doing a job. Every time one has to do something, people should make connections between who it is that you are and the things that you're doing. As a nurse, you should always be professional when you speak to your patients, when you speak to your coworkers, when you speak to doctors and everything. So that's part of what that point that I'm trying to make. Okay. The next one I have is to be the best. A lot of times, doing the best you can is not good enough. It's very important people get used to do the best they can and go that extra mile. It's simple. It really should be something that we all be practicing. Be a communicator. Invite new ideas, opinions, and feedback from others. We all can and we learn from others. Everybody has something to teach. Everybody has something to learn from others. So that's part of being a good communicator. Be accountable. Accountability is very important in nursing. Do what you say you will do and take responsibility for your own actions. That is very important, and we should all be practicing that as a trait of good behavior. Be collaborative. Team effort is always part of nursing, teamwork. We should always be active members and do a collaborative work every time we work. That's how things get done in the nursing field. You're not alone, and you should always ask for help. You should always offer your help, and things will get done in a faster and probably better way. There's always something new to learn from others, as I said, and when you work as a team, that's part of doing what we do. The next one will be to be forgiven. Everybody makes mistakes. We should all give people a fair chance and learn from mistakes. That's how that's how one can improve, by learning from your mistakes. Be current. Keep knowledge and skills up to date. In nursing, you always have something new to learn. There's always to be learned. You will never know everything. That is for sure. Be involved. Be active at some level. This can be in the unit, this can be at the hospital level, this can be at this local level, city, state. be involved. That's a good trait to have. The next one will be to be a model. You always want to make an impact on others. What a person says and does reflects on his or her profession. As nurses, we always want new nurses to learn from the people that have been doing it for a while. There is nothing more rewarding than having a new nurse say, "Oh, you're doing a great job. I like the way you do things. I like the way you teach. I like the way you behave as a nurse." That's kind of a very positive feedback to receive from new nurses, and it's part of once you have taught somebody something, you will always get a feedback, and it's very important to be a good model. Be responsible for self. Okay, you have to take responsibility for your own learning needs and be assertive in making them known to your colleagues. When one learns something about anything, a magazine, an article or something, and it's good information, I think you should always share it with others so they can benefit from your knowledge as well. Okay. Be prepared. This is very simple. I mean, it goes to the fact that when you're ready, when you come to work, you should always be prepared to start your shift, have your clothes on, ready to go. So in order for the shift that you're leaving to go home, and don't take away anything from them by being late, by prolonging their stay at work when it's really not necessary. In addition to those points that I mentioned, I really wanted to talk to you about two phrases that are not said enough. When we work as a team, we always expect others to help each other and to make the job easier for everybody. When we're asking somebody to do something for us, for a patient, or for others, we should always use the phrase please. I see that is not the case in many instances, and it's very important for people to be reminded that please and thank you can really make somebody's day anytime. One could be having a bad day, and it is important that we recognize that each other's as members of the team. When you say ask somebody something for them to do for you, and you say please, I mean, it really doesn't take 2 seconds for them to realize that you're really asking them, because you count on their you count on them for them to do what it is that you're asking them. Also, once that task has been completed, you can say thank you. I appreciate what you did for me, and it's very important that they recognize that you know that they really help you. At the end of the shift, they said thank you for your help. Although it was a busy day, I think I appreciate your help. And nurses sometimes do not use that as a tool to enrich the lives of others. For example, techs, I believe that they go home without that sense of worth that we could make them feel. I think if we, at the end of the day, acknowledge that their labor, their work was not in vain, it is important for them to realize that we care. That's something that I do, and I know for sure that when I say that to somebody, it really makes them feel good about themselves. Okay. From all the points that I had discussed, I really would like everybody to take a moment and think of what it is that somebody has done, what it is that someone has shown that they practice, who in our unit is one of these points that we talked about. It would be nice to recognize those people that are making the effort to make our unit a better place to work. I'm going to leave this in the break room, and if I would like everybody to vote, to just write the name of the person that, for example, has been the most forgiving, the most accountable, the most collaborative, the best that there can be, the best communicator. So that would be something nice for people to recognize, that we value their professional behaviors here at Ward 3 Center. So I'll leave the box in the break room. I'll give a couple of weeks. I'll count the votes after a while, and then come up with a little prize for somebody. Who knows? It might even be you. Thank you, and I hope you have a good day.